Hi, hello, welcome to another live. Okay, and so today we're talking about prescription drug costs, okay? And so every year, prescription drug costs rise up. The same with health insurance. Every year premiums go up. And so that increase greatly impacts your finances, okay? And so, if you are having a hard time paying for your Medicare covered prescription drugs, um, now you have to be eligible for Medicare. Okay. Okay. So, there is a program that is available if you qualify. And so today I'm going to be sharing with you that program and how it can help you save on your prescription drug costs, and you don't have to use a discount card or something like GoodRx, okay? So, hello, Insure Black America. My name is Katrice-Daniels, and I am a licensed health insurance broker. I am licensed in 19 states, and my goal is to be licensed in all 50 states by July of 2021. And I am also the founder of INSURE Black America, where my mission is to close the coverage gap in healthcare for between Black Americans and other racial groups. Okay, and so getting into the content. So the drug Medicare prescription drug program, it gives you a choice of prescription drug plans that offers various levels of coverage, just depending on how many medications you take, what medications you take, etc. Excuse me. And so that's what's called Part D. Okay, Part D is the prescription drug cost. It's the prescription drug plans, excuse me. And so once you have enrolled into a Part D, okay, once you've enrolled into a Part D, then you can apply for a program called Extra Help through Social Security, okay? And so Extra Help, it is also called the Low Income Subsidy Program, okay? And so what Extra Help does is Extra Help, it helps to pay for your monthly premiums in your prescription. So when you get into a prescription drug plan, there is a monthly, some of them, the majority of them have premiums. I haven't seen a prescription drug plan that doesn't have a monthly premium, but there are ones that are low, like $14, $15, just depending on where you live. But it will help to pay for that monthly premium. It will also help to pay for the deductibles. Now, when you have a prescription drug plan, just like a regular medical plan, they do have deductibles. Now, some of them, the deductible I think the deductible is $435 is what it is this year. And so you may have some plans that say tiered 1 and 2, no deductible. You don't have to meet the deductible before the plan will start to kick in and help pay for your prescription drug costs. And then you have, and then on tiers 3, 4, and 5, or however many tiers that prescription drug plan formulary has, those would be subject to the deductible. If you qualify for the Extra Help program, then Extra Help will pay for those annual deductibles. It'll also pay for any co-pays. So however much you're paying for your medications. So now when you have full Extra Help, you may be paying between $1.25 and $3 and I think 25 cents. It's a range that you get, and then brand names you pay up to like $8 and some change. And so you do have to be, now in order to qualify for Extra Help, not only do you have to be, you have to first have Part A, either have Part A and or Part B. You have to have both or one or the other, okay? And then if you decide that you want to go into a Part C plan, you can still use the Extra Help with your Part C plan, it'll only apply towards the drug portion of that plan. So if the Part C has a monthly premium to be in the plan, you still have to pay that premium. But any thing toward that have related to your drug cost, you don't have to pay that premium. Okay. You do have to live in the United States, obviously. Um, and you cannot have more. So if you're married, if you're a married couple, you cannot have combined savings, investments, and real estate that are worth more than $29,000. Now, if you are single, it's just you, you're not married, then it's $14,600. Um, Now, if you're separated. Because on the Social Security website, it does say if you are not currently married or living with your spouse. Now, when it comes to assets, you do not count your home, the home that you live in. You do not count your vehicles. You don't count your personal possessions, life insurance, burial plots, irrevocable burial contracts, or any back payments from Social Security or SSI. Okay? Um, None of that stuff counts. Okay? Now, if you have more, if your assets, exceed more than the figures that I just said, you may not qualify for extra help. However, you can still enroll in a Part D. Okay? And it's actually with the Part D, I made a post yesterday. But when it comes to Part D, you do have to enroll in a Part D when you're eligible. Okay? So if you're eligible for Medicare, say you turn 65 September 1st, okay? So you have 3 months before the month of your birth and then 3 months after to enroll in a plan. Either get original Medicare in a Part D or you get a Part C. Okay? Now, once that enrollment period is over, if you're not enrolled in either a Part C or a Part D, you will be charged a Part D late enrollment penalty. Now, the Part D late enrollment penalty, let me pull it up here because I want to make sure. It's a 1% penalty that you are charged. Here it is. Okay. So it is a 1% penalty of the average monthly prescription drug premiums for the year. So say the average is $33. The average monthly premiums is $33 over all of the Part D plans, okay, that are offered. And that's the average. So your penalty fee will be calculated at 1% of the $33 multiplied by the number of months that you were late enrolling into a Part D. Okay? So in this example, if you were 12 months late, okay, so you went a whole year without being enrolled in a Part D or a Part C, because the Part C's, they have prescription drug plans attached to them, most of them. You can get some without, but in another video, in another live, I will go over the Part C's because a lot of people seem to not understand those, and so I will break down the Part C's. But if you go 12, say in this scenario, you're going 12 months without enrolling in a Part D, then your penalty would be $3 and some change. And that is paid on top of the actual premium. So you pay the $33 plus the $3 and something change. Now that follows you for life. It doesn't go away. Okay? You always are paying that penalty unless you qualify for extra help. If you qualify for extra help, then you no longer have to pay the penalty. Okay? So it's the Medicare, the extra help, it is a very great program. so many people so many people don't even know that it exists. So many people don't even know that the Part D, that you can get help. They just assume that you get a Part D and that's it. And so if you would like to apply or you want more information, you can call the Social Security Administration. That number is, and I'll also put it in the comments once the video is over. The number is 1-800-772-1213. Again, that's 1-800-772-1213, and that's the number to Social Security. You can call them. You can ask them for information. You also can go to ssa.gov. And when you get to ssa.gov, there's a little button, a little link that you can click that says, I want to apply for extra help, or I want more info for extra help. If you're tech savvy and you don't want to sit on the phone waiting to speak to someone at Social Security, you can go online on ssa.gov and get more information on that. It's online there as well. Okay. If you have any questions regarding extra help, you can also just drop your questions, your comments right here on the live, and I will answer those questions. I don't see any right now as I'm going live, but if you are watching this on the replay, or you think of some questions after the live is over, you can go ahead and drop those comments right here in the comment section of the live. I do get notified, so I check periodically to see if there's comments, and I'll go ahead and I'll answer those comments. And so thank you to all who jumped on and watched the live today. And thank you to those who watched the replay. If you are watching on the replay, just go ahead and put hashtag replay just so I know whether you caught it live or replay. And if you found value in this live today, go ahead and share it out so that other people may find value in this live. We are coming up on the annual enrollment period for Medicare. And so it'll be so appreciated if you could share out this live so that other people will know about this program. And if they qualify, they can go ahead and they can apply for the program so that they can start getting those savings when it comes to their prescription drug costs. Also, if you have not liked INSURE Black America, if you're watching this is your first time watching me, and you have you got value and you have not liked and followed INSURE Black America, go ahead, give us a like and a follow here on INSURE Black America. We greatly appreciate it. And if you are looking for health coverage, or if you have questions about health coverage, you can schedule a free advising session with me. In that session, I just go over your health care, what it is that you need, your health care needs. We just kind of do an assessment to see what type of health insurance you're needing, and then we go from there. So if it's a free consultation, it doesn't cost you anything, and you can click the book now button and schedule your free consultation with me. And so again, thank you all for watching. You have a great rest of your evening and just remember that the ER is not health insurance, and that together we can close the coverage gap in Black America versus other ethnic racial groups. You guys have a great rest of your evening, and I'll talk to you soon. Bye-bye.